Robotic surgery is becoming more popular, especially with patients, and Dr. Tim Gajewski joins us right now. He is a urologist here. You have been doing robotic surgery for how long now?
For 5 years.
For 5 years. You're the first, are you the first physician here?
We're the first group that has done the procedure here in Charlotte.
Okay.
And I was one of the first people within our group to be offering the procedure.
Okay. Is it primarily, you're a urologist.
Yes.
Is it primarily with regard to prostate surgery or kidney stones? Is that primarily what it's being used for right now?
We're using this technology to do kidney cancer surgery now, so we take out a portion of the kidney rather than the entire kidney.
Yeah.
We're now doing prostate removal as well as bladder cancer surgery. So it's expanded from initially where we started using it just for prostate, now to these other realms of urology. So
clearly, you're a proponent of this. What made you first decide to try it?
We had seen 5 years ago that laparoscopic surgery was occurring and transitioning in certain things such as appendix surgery, gallbladder surgery, and saw that those patients were recovering a lot quicker than the conventional open surgery. So this company allowed laparoscopy to be performed a lot easier, and so we investigated it. We went through training where I'd been doing the open procedure for 15 years prior to this, and then now we could use laparoscopic surgery with better vision. So from there we've gained an experience and wanted to offer something where we wanted to have less complications for the patient and a quicker recovery.
There was a pretty good article in the New York Times recently with regard to it, and the doctor at the beginning of this saying is that patients are interviewing them wanting this procedure. At the same time, it points out that there have not been to date any clinical studies with regard to traditional methods versus robot-assisted. Clearly, if you're continuing this, you're on the side. You're on one particular side. Are you aware of any detractors, and have you been paying attention to with regard to what they have to say?
Yeah, absolutely. There is a controversy, and I think there's a group of surgeons who haven't adopted the technology. So there's a long learning curve to learn how to do them properly.
Yeah.
So people have hesitated to adopt it. They think there wasn't a benefit compared to the open surgery. I've compared my 15 years prior experience to now 5 years, and clearly in our thousands of patients we've now done here in Charlotte, there is an advantage to a much quicker recovery. People never used to go home from the open procedure within 24 hours. That just is a fact. Blood loss or transfusion rates less than 1%. And we're seeing a quicker return to urinary control and potency compared to the open. So in our experience, and I think it mirrors a lot of the big centers where they're doing a lot of these procedures, I think it's very clear.
Okay, all right. And definitely, as always, patients, when they're entering into any procedure, should do a little investigation.
Yes, absolutely.
Okay.
I think it's important to go to groups that have done a lot of these procedures. Clearly, the outcomes are going to be better. So that's very important.
Okay, Dr. Tim Gajewski, thank you so much for enlightening us a little bit with regard to this.
Thank you.
Appreciate your time.
Appreciate it. Thank you.
That's our in-depth conversation for today. We'll be right back.